I'm here with my friend Richard. Hello, Richard.
Andy, it's good to speak to you. I'm in Canterbury this week, just a bit down the road from Margate. But yeah, lovely to speak and lovely to hopefully contribute this evening.
A different background, a different light, which is all interesting.
Indeed.
But if you don't watch the video later, you'll have no clue what we're talking about, which is a good reason to say, go and watch the YouTube video when it gets posted there. Now, last week, we were talking about all sorts of things. We had a question on red hair, which was not a red herring. Haha. But you got very excited. I actually put the same question to Anne-Laure Jackson from an occupational therapist, sensory health perspective, and she went, ooh, that's interesting. I need to go and find out about that. So you got excited too. So what have you got us on the subject of red hair?
Well, the first thing to say is normally when we have questions, we deal with the questions and then move on to tonight's subject. But I was so taken aback and thinking, do you know, I don't know much about this. So I'm turned it into all of tonight's subject. We're going to look at red hair dash. Is it a superpower or is it a liability? There we go. There's a nice confrontational title. I don't know how many of the listeners have red hair. I can tell you that it's relatively common, as we'll look at the statistics in a second. But that's where we're going to go tonight. We'll look at red hair, auburn hair, ginger hair, whatever you like to call it. That's tonight's subject.
I'm looking forward to it because I just read the question out that was sent in. The only memory I had was somebody who said, and I can't remember if they were red hair or ginger, but when they go and have dental work, the anesthetic doesn't work the same. And that was the only bit I remembered.
There were two bits, both of which we're going to look at towards the end. One was the dental work, and the other was childbirth,
Yes.
and red hair. So I'm going to look at both of those two towards the end. Yeah, it just got me thinking. Okay, I mean, logically, should it make any difference? Well, yeah, but what does the science say? So that's what we're going to look at tonight. And yes, I think it's quite interesting what science has turned up.
Cool. I mean, the thing is, think about skin color. If someone's got black skin or white skin, there are differences physiologically.
Ooh, massive,
So
massive.
if skin color can be a difference, then we'll find out. So I like your title. I've lost the last bit. Is it a superpower or?
Or a liability.
Thank you. I like
News
that.
or good news or bad news having red hair.
Right. Fine. Well, let's dive into this thing. What have you got for us?
Yeah, so I'm going to look at the sort of personality, anything on personality, the pros and cons, the good news, the bad news medically, and then turn to these specific questions that the listener came up with on childbirth and dentistry, for example. So the first thing I wanted to say is I wondered when red hair dated back to, and apparently it's been noted for 50,000 years, and it came from the grasslands in Central Asia. Well, whether it came from there or whether it's first noted there, but there we go. It comes back to Central Asia. And I was thinking, well, okay, what about any famous redheads? Well, of course, Queen Elizabeth I. Whenever we see pictures, and funny enough, our Ukrainian lad that was staying with us for a couple of years until recently, he came back having drawn a picture at the school of Queen Elizabeth I, because that's what he's asked to do. He's quite good at drawing. And of course, there she is with her red hair. Um, in the Bible, Esau, famously, wasn't he? Jacob and Esau was Anne Hairy Man, but not just Anne Hairy Man, but Anne Red Hairy Man, covered in red hair. And of course, interestingly, red hair was viewed as good luck. I don't know if you knew this in Roman times, to the extent that Romans would pay more for red-headed slaves. Don't know
Interesting.
why. I'll just throw it out. Christians, however, did not see red hair. So as such good news. And apparently, and this is to our detriment, in the 16th to 18th centuries, red hair was associated with the devil and witchcraft, and redheads were wiped out in order to cleanse society. So isn't that an interesting cultural thing? How terrible what we have been responsible for over the years. So we apologise. Anyway, that's the history. What have we learned about red hair more recently? Well, of course, it comes down to our genes. Chromosomes are made up of genes. And what we discovered, there was a mutation, an error in one of the genes responsible for producing skin pigment and hair pigment. Because, of course, often, mainly redheads tend to be very pale skinned, don't they? And it's quite common in Europe, 2 to 6% of people have the redhead genes. In Scotland, up to 13% of people are actually redheaded, up to 13%. And when you do the maths, that means that 40% of people in Scotland have the red-headed gene. Why? Because both father and mother need to have the gene for the red hair to be expressed. So 40%, nearly half the people in Scotland have
Wow.
got a red-haired gene. By the way, a really striking combination, quite rare, but pretty striking, is red hair and blue eyes. If someone has that, you are one in a million. You are very striking. Red hair and blue eyes. So, what are redheads like? Well, interestingly, even though it's a recessive gene, so one from the mother, one from the father, that should mean that males and females are equally distributed. In other words, just as many red-haired males as females. But no, 80% of redheads are male. I think that probably goes with my experience that most redheads I know are male, not female, because the genetics aren't completely straightforward. So women, well, redheads are a rarity, and they are described as fiery. This is the superpower, fiery and sexy. There we go. The men, not quite so much, often solid, perhaps not so fiery and sexy. But the women, there we are. It's a superpower, the way they look and the way they act, their personality. But is it medically good news? Well, I might say the literature is not unanimous here. Some studies, for example, show there's an increased link to Parkinsonism. Other studies refute that. Of course, it is definitely associated with pale skin because of the lack of pigment, and thus a greater risk of skin cancer. However, other studies show, this is interesting, I didn't know, that redheads produce more vitamin D, giving them a reduced chance of skin cancer. So whilst the skin is pale, it's more dangerous. If you've got a bit of more vitamin D, it's a bit protective. So there we go. But one thing it does do, the more vitamin D, it reduces their risk of aging in the skin. The skin ages more slowly, so redheads keep their looks longer. So there we go, another superpower for redheads. One strange thing is redheads seem to feel heat and cold more easily. So there may be a difference in their temperature regulating genes. So these are a few things, but there's two areas that I particularly wanted to focus on, which I've discovered. The first one is on alcohol. And this is quite interesting. Redheads have other genetic variations, and one of them means that they process and eliminate alcohol faster. So they've got a higher tolerance. They work, if they have a drink, they work through it quicker, and they have a higher tolerance for alcohol. In a sense, that's good news. They get drunk less easily. But perhaps as a result of that, they take more alcohol on board, and they have a greater chance of alcoholism. So it's just something to be wary of if you're redheaded. Just watch the fact that you maybe can hold your drink better. Yeah, but there's a downside there. But the one that I really wanted to focus on was in relation to the two questions we were asked. Pain thresholds. Some studies show lower pain threshold, others higher pain threshold. But the two things that did seem to come out, dentistry, there is a difference in dentistry. If you're redheaded, they are resistant to local anesthetics. And so many redheads are quite anxious when they go to the dentist because the dentist gives them a normal dose of lidocaine, local anesthetic, and it doesn't work because they need at least 20% more to produce the same effect. Now, oddly, they need less opioids, they need less morphine at other times, but in terms of local anesthetics, they need more. So there does seem to be a dental effect that was mentioned by one of your listeners. That's the first one. Childbirth, the same. They don't seem to respond as well to epidurals. They're less effective. So they need more pain relief in labour. And they also seem to bleed more after both childbirth and some other operations as well. So a bit like your occupational therapist, it's a bit hard to know why, and obviously more research is needed. But there do seem to be some differences in redheads to the rest of the population in relation to surgery, dentistry, childbirth, alcohol, skin colour, obviously. Some advantages: fiery, sexy, better skin. They hold their skin longer, but some disadvantages in operations, perhaps. There we go. I think that's probably no big surprise. With all these things, there are advantages and disadvantages, because if there were purely disadvantages, well, redheads may well have died out. And they haven't. In fact, they're pretty common in the population. So there we go. Good news and bad news.
Okay. That was fascinating. So dentistry, yes, they have issues with anaesthetic, which was the question that was raised, and in childbirth, yes, issues with pain relief. The one that really I don't get is 20% more and local anaesthetic is needed in a dentistry situation for teeth extraction, fillings. But actually, they need less opioids and morphine.
I can't explain that. I'm simply saying what the science has found.
Yeah.
That yes, perhaps they're more sensitive to what sounds like they are more sensitive to opioids via however the opioids are given, whether it's oral, whether it's intravenous. Whereas, of course, lidocaine is nothing to do with an opioid. It's a local anaesthetic, a pain blocker. So it works totally differently. So one type of pain relief they need more of, and another type of pain relief they need less of. Isn't that interesting?
It's genuinely fascinating, is what it is. I thought I'd heard this, but I just thought that people were. I was not making it up, but it's like, are you sure that's really the
Is it
case?
an old wives' tale? Is it something that's
Exactly.
been handed down? But I think what we discovered, don't we, with science, is that sometimes what people have believed, yes, sometimes it's not true, but actually often there was some truth in it. We just didn't know why. And even though we've got some information now, we still don't really know why redheads need more lidocaine for dentistry and stronger epidurals as well for childbirth.
You can say old wives' tales, I guess, but I mean, the thing is, where's that come from? Where's that? That's got to have an origin, a source of
It's going to
something.
be experience, isn't it? In the main, people have noticed these things, even if they can't say why.
Exactly right. And then, yeah, childbirth. Interestingly, epidurals are less effective. I can hear any redheaded, soon-to-be mother-to-be is going to be thinking,
Well,
right.
apparently on the labour ward, it says, so it used to say in the old days, you wouldn't get away with it now, beware the redhead on a labour ward. In
Wow.
other words, this is going to cause, because not only are you going to need higher pain relief, but they may well bleed more after surgical procedures, after childbirth. So beware the redhead, apparently, was a notice on delivery wards in the past.
Yes, I don't think you would get away with that today.
You couldn't possibly get away with that now.
No, and rightly so. So another one that threw me. I mean, we're not going to go into the, I suppose, ancestry, but 40% of Scottish people. That's quite a high number.
The gene, absolutely. Well, you see, the thing is, if you need genes from both parents, so it's 40% times 40%, which is 16 over 100 if you do the maths, which is up to sort of 16% of people being redheaded. And in Scotland, the stats were 6 to 13%. So yeah, it's along those lines. Bear in mind, there's a few other genetic variants that have act as a factor as well. So it's a very common gene, but it's not always expressed.
No, but it's interesting. But the one that I really thought, oh, I think like God's at work here, is that pale skin tends to be with redder hair, which means obviously greater risk of skin cancer if you're more pale skin, and yet they produce more vitamin D. So it sort of feels to me like God designed them with a bit of a self-protection going on.
Good. Well, yeah, couldn't have put it better. That's exactly that. There's a problem here, but I'm going to give you a helping hand as well.
Yeah.
Absolutely.
Yeah. I'm so speechless. I thought you were going to come back and say, no, it's all rubbish. It's not true. I was fascinated by how interested you were and how interested Anne Lord Jackson was,
Yes.
because it was that, well, that can't be, but let's find out if it is or not.
Well, I remember my eyes were opened years ago when I went to Nepal as a medical student, and I saw acupuncture being used for eye surgery. A needle literally placed behind the eye, alongside, and deep into the brain. And I'm thinking, I've heard about acupuncture stimulating pain relief. This is a big test, if you're having your eye operated on. Person never moved, never felt a thing. It clearly worked. And it made me think, okay, well, you might have preconceived ideas about acupuncture, but the fact is, you've just seen it work. Your preconceived ideas need to change.
Yes. I guess the problem is we see some of these medical things, we sort of attach some sort of religion bit to it. But again, acupuncture, I mean, that's needles. If you've got no pain relief, it didn't exist, then what are you going to do? You're going to try and experiment, perhaps not in a very good way, but you're going to find results eventually.
Absolutely. And yeah, I certainly wouldn't subscribe to the sort of Eastern religious aspect of acupuncture. No, leave that alone. But there is a Western acupuncture, which has nothing to do with religion, where, yeah, they've learned things about, where you place your needles, which can have an effect elsewhere in the body. And I'm thinking, oh, well, there must be something in this. I have seen it work.
Yes, I'm happy if needles stay far away from me. I'm not a fan
Take
of
a
the
general
whole.
anesthetic.
Yeah, just give me some gas till I'm unconscious. Then you can. I don't care. Right. Okay. I loved this one because I really thought you were going to say no, not true. But I also know what I like about it is you would go away and actually research it properly and come back with a balanced opinion.
It's what I love about the questions is if I know the answer, fine. If I don't, well, there we go. Go and look it up. Let's see what we can find. And oh, right. Oh, that's interesting. Again, we don't always know why such an effect takes place, but the science shows that, as we've been speaking about tonight, more research is needed to find why that's the case.
Fiery is an interesting one. Can you actually scientifically test is somebody fiery or less fiery? That could be quite a hard one. I can't imagine
That's a hard one.
how would
Yeah,
the laboratory.
that's a sort of subjective thing. Funny enough, we've got a wonderful secretary at work who's red-haired. It's a lady, so one of the less common. And boy, is she fiery. Won't say anything else about her, but she's certainly fiery.
No, I think you're probably best not to, just in case. Right. Thank you, Richard. If you've got any questions from that, you might agree or disagree. That's okay. Or you've got other questions where you're thinking, is this really real and true? Then you can let us know. I'll put them to Richard for you. Email address for that is hello@pure247radio.org. Hello@pure247radio.org, and ask me, and I will ask Richard on your behalf. Thank you, Richard, for another fascinating session.
My pleasure.
I'll leave you to your day. Thank you.